Hi, my name is Anthony and I'm a respiratory care student in Southeast Community College. So before I start, can I ask for your complete name and date of birth, please? Okay, so I already got his date of birth and complete full name. So before I'm going to proceed, I'm going to do a hand hygiene. And after that, I just have to confirm by checking it by the ID band if it's inpatient. And then once I'm going to confirm it, I'm going to start assessing the patient. So before I'm going to start, I'm going to assess you by listening with your breath sounds. Can you lean forward? Lean a little bit forward. Okay. Then after that, you have to clean this again. Then once I'm done listening breath sounds, I'm going to check also its respiratory rate, heart rate, and if possible, if you have a portable pulse oximetry, you can also check the patient's level of saturation if you have the portable pulse oximetry. So the reason why I am here is because the doctor ordered to have a breathing treatment, which is a small volume nebulizer. So there is for your information, this test is to help with your breathing and also to help mobilize your secretions, as what I've heard from your breath sounds. And this procedure also is a non-invasive, so which you don't have to worry anything. Okay, so here is the neb kit. So this one is, there's a medication inside. So I'm going to instill medication in here, and then all you have to do is you just have to put this one, the mouthpiece, inside your mouth with your lips sealed. And then once I'm going to put this put inside your mouth, you're going to do normal breathing with occasional deep breaths. Then after that, you have to exhale normally. And then another thing is, when you're going to do nebulization, which is via compressor based, you just have to put it on the bedside table. Never put it on the floor, as there are some bacterial infections or dirt. And then another thing, if the patient could not able to tolerate the mouthpiece, you can shift it to face mask. And when you're going to shift it to face mask, you have to ensure that the face mask is properly fitted here, the nose bridge and the whole mouth, and it should never hit, or the aerosol droplets will not reach the eyes. And then now that the procedure is done, I'm going to remove the neb kit. And then once I'm going to remove the neb kit, you're going to rinse it with sterile water or distilled water. So never rinse it with tap water, because it might be contaminated with Legionella. So now that it's already done and rinsed, I'm going to take this off and then air dry this, put it in the side, and then after it is going to reassess the patient by listening again the breath sounds. Lean a little bit forward. Okay. Then aside from that, I'm going to also check the respiratory rate, heart rate, and if possible, the portable pulse oximetry if you have. you can also check again the level of saturation. And then after that, I'm going to tell the patient if he or she is able to expectorate or cough. So are you able to expectorate or cough right now? So if the patient can able to expectorate or cough, you just have to assist them, and also you can just give them a cup so that whenever they expectorate some sputum or phlegm, they just have to expectorate it with a specimen cup. So every time you're going to assist the patient, you can tap it in the back, especially if there are secretions noted. Then after that, I'm going to wash my hands. And then after washing my hands I'm going to inform also the patient if when will be the next therapy given, especially the frequency or time.